Tonight on Your Health, we'll be talking about the treatment and understanding of eating disorders. Jody Whipple is a nutrition therapist and a certified diabetes educator. Jody has specialized in counseling individuals with eating disorders for the last 10 years. And Allan Elfant is a clinical and consulting psychologist. His clinical practice involves engaging clients who are struggling with issues related to depression, anxiety, and distress in their relationships. They're both from State College, and they believe in a team approach to the treatment and understanding of eating disorders. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're here to take your phone calls and answer your questions about the treatment and understanding of eating disorders. Call us at 1-800-543-8242 to join in the discussion. Well, to start things off, I really want to just throw out to both my guests, what are eating disorders and how is eating disorders different from disordered eating?
Well, Chris, first of all, eating disorders can be classified into several different categories. Anorexia nervosa, for example, is a classification of eating disorders that is characterized by someone getting less than 85% of their ideal body weight, severely restricting their calorie intake. People may do this and not get below 85% of their ideal body weight, but still have disordered eating. So you can see where there's a lot of medical issues with electrolyte imbalance and temperature control of their body, and then also psychological disturbances that of course go along with it.
Okay, so anorexia nervosa is one category of eating disorders. Allan, other ones?
Yeah. Yes, there are. I would like to say something first about eating disorders in general.
Okay.
From a psychologist point of view, an emotional point of view, eating disorders, or for that matter, extreme disordered eating, involves a state of suffering, of distress around issues concerning food, eating, how one feels about one's body, how one feels about oneself. So in addition, as Jody was saying, to anorexia nervosa, there's bulimia nervosa, which involves binging and purging. And then there is binge eating disorder, and that is people who binge but do not do anything to get rid of the calories. And then there are people who really are severely overweight, which in itself is an eating disorder. Okay,
so there's anorexia, which is not getting enough calories and losing a lot of body weight. And then there's binge eating disorder and bulimia nervosa.
Mm-hmm.
Now, can you describe what is a binge? Just overeating chocolate bars?
Well, a binge is consuming an amount of food that would be excessive in a short amount of time. That would be excessive for most people.
And a short amount of time is an hour?
It could be a few minutes. It could be longer. It is a driven behavior. And it's very important to realize that this has nothing to do with pleasure or nutrition. It has to do with a compulsive, compelling need to take in a certain amount of food with probably the inevitable result of getting rid of it by vomiting or some other kind of behavior.
What other kinds of behaviors? We know that binging and then purging usually is vomiting. Are there other ways to purge calories?
Do you want to take that?
Sure.
Okay.
Yeah, there certainly are. In fact, there's a diagnosis called exercise bulimia, where somebody may binge on a tremendous amount of food and then they end up exercising obsessively to get rid of the calories. Also using laxatives or diuretics or using Ipecac to make themselves throw up. And there's actually a whole ritual oftentimes that goes along with the whole purging.
Okay. So, Allan, I heard you say that this is not about nutrition.
Mm-hmm.
Well, as a nutritionist, I really respect that because it's an enormous problem.
Mm-hmm.
But if it's not about nutrition, which most people think it is, then again, can you tell us what is the underlying issue?
Well, again, I'd like to make a preliminary thought here, and that is whatever ails us, whether it's an eating disorder or depression or anxiety, and this may sound paradoxical to the listeners, those behaviors are really attempts to solve human problems that the person may or may not be aware of. They're the best the person can do to try to address certain human difficulties and struggles, which they may or may not be aware of fully. That said, food and eating goes back to the most primal and primitive aspects of ourselves. We are born in connection, usually right away to our mothers. Food and eating is a human bond. It's a love bond from the beginning. We eat in social context as infants. In addition, when we get hungry from the time we're infants, we're frustrated, which makes us dependent on somebody to feed us. And then issues of power and control enter. We need somebody else to help us, but we also are powerless, especially in infancy, to do this on our own, to feed ourselves. We must have help from the beginning. This renders us into a place of somewhat helplessness, dependency, reliance on the care of others. So how food and eating is addressed by caregivers, by mother and father, by family, will be pivotal in terms of what sentiments and attitudes a person has as they grow older.
Okay. If you're just joining us, this is Your Health, and we're inviting your calls. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're talking with Jody Whipple, a nutrition therapist, and with Allan Elfant, a clinical psychologist. We're talking about the treatment of eating disorders. Call us with your questions at 1-800-543-8242. Well, now that we sort of have this platform for talking about eating disorders, understanding them, and even maybe talking about some treatment issues, let's just talk about who is vulnerable or most vulnerable for succumbing to some of these types of disorders.
Well, Chris, I certainly see a lot of college students, and that's an area that is not it's not uncommon at all to see young women, especially with eating disorders, although young men certainly suffer from eating disorders. In addition, there's different sports that lend itself to being vulnerable for an eating disorder. Gymnastics, for example, track and field, being a model. You probably don't want to call that a sport, but models, that's certainly prevalent in the media, suffering from eating disorders. So there's those more obvious types of people that are more vulnerable.
Why with those specific groups? What is it?
Yeah, that's a good question. A lot of those groups, and I should mention figure skating as well, a lot of those groups of people are judged not only on their skill, but in the judging of the events, appearance. Now, track and field wouldn't be the same, although track and field runners have the belief that the thinner they are, the faster they're going to be, and so that can contribute also.
Okay. And Allan, would you say that this is a primary population of people that you see as well?
Oh, most definitely. And as Jody was saying and implying, something like 90% of all eating disorders are female, and something like 10% are male. And there are all sorts of, I think, generalizations we can reach about why women, girls are most susceptible, and girls at younger and younger ages are. I mean, it is very common, as I think some data has come out, that 3rd and 4th graders are besieged by these sorts of notions of dieting, how they look, dress, and so on, to excess. And an underemphasis in our culture in general on the inner life, on reflection, on the quality of life. It is so much about performance, looks, appearance, achievement, culturally defined success, and not about the individual.
So do either of you blame the media for eating disorders, or is it a much bigger picture? Because I have seen articles where the media is frequently targeted, the models who are very, very thin. And we see a lot of models who have come forward and they've actually identified themselves as having an eating disorder. So is it the media that ultimately fuels the fire to be thinner and thinner, or is it really something, is it coaches? Is it parents?
I would really have to say, Chris, that it's multifactorial. We're looking at a psychological, genetic, biological, sociologic problem here.
Okay.
And so certainly the media contributes. I met a woman who is actually doing some work out in Hollywood trying to get people talking about these kinds of issues, and she had the opportunity, I was telling Allan, that she had the opportunity to go backstage with a fairly famous singing group that was being photographed for Rolling Stone magazine. And the man had, the young man had his shirt off, and when he got done, the producer said, okay, come on back here and you can pick out which abs you want to go, and they were going to technically alter the picture, you know, so that's, it's very prevalent. But then, as Allan was saying, you know, there's a familial component, and there's certainly genetic information that suggests that that's a component also. So to blame one, you know, to blame coaches or to blame the media or to blame the family, I don't think we can just throw out blame to anyone. It's a big picture.
Okay. Well, we have a caller. We have Jason from Highway I-80. I understand, Jason, you're in a truck, right?
Yes, ma'am, that's right.
What question do you have for us?
Well, I was enjoying your show. I just happened to be driving through the area, and I'm from Birmingham, Alabama.
Okay.
And over the last couple of months, it's sort of been an ongoing joke with my friends that when I get upset, I'll eat. I'll go, like, at the truck stops, there's buffets, or I'll order, and so, like, for months, I've been trying to say, well, now I'm going to eat healthy because I'm starting to gain weight, not feel well. And so a day or two will go by, and I'll have chicken salad and different things. But then something will happen that I become upset, whether it's, you know, a delay or traffic or you know, personal. And then before I know it, I'm at a buffet or at a place ordering, you know, at a diner, the largest breakfast they have with all the trimmings, and so I'm not sure if that qualifies, you know, as a disorder as far as the other serious things you were talking about. But I heard the psychologist say something about the compelling to eat, and it just really struck a chord within me. And I just wanted to know maybe what his thoughts were on that.
Well, I'm really glad you called. Let's see what he has to say.
Okay, I wouldn't say that you have an eating disorder. I would say that it connects to what I was saying about how we originate in our lives, that we're hungry. We need to be fed. We rely on being fed. Along with being fed, we're held, we're soothed. And often when infants are fed, they then fall asleep. So when we're tense, the impulse or even compelling need to eat may be very connected to the interconnection between being comforted, being soothed. The term comfort food comes to mind. And so it sounds like one way your tension is being manifested is by a need to eat.
So in a way, this is good news. Maybe you don't actually have an eating disorder, but you want to eat those famous truck stop foods to get some comfort, maybe.
Yeah, and well, the thing that, I guess what, when I thought of it as a problem, though, was just recently, because I did it again today after I had, for 2 days, eaten healthy. And so I really am trying to commit in my life to eating healthy, and because I'm now up to 220, and I was 165, and, I look around at these other, people, and I don't want to look like that. And I'm surprised at how difficult I'm finding it to be disciplined in what I eat and my behavior.
I do have another suggestion for Jason. It might be useful to ask yourself, when you have this overwhelming hunger you're referring to, what else might be upsetting you or disturbing you or on your mind or going on in your life that might be important to think about and reflect on.
All right. Okay. I thank you so much for your time. I appreciate you answering my question.
Thanks, Jason.
Okay, thanks so much.
Drive carefully.
All right, thank you.
So, Allan, would it also be possible, I was just listening as a nutritionist to Jason's question, and when someone tries to eat healthfully, oftentimes within that context, they may be eating fewer calories. And then all of a sudden, after maybe 2 or 3 days of calorie restricting, in an attempt to eat more healthfully, could he then have some signals that his body is saying, you have really been underfeeding me I want more? Is that possible?
I think that's one for you to field.
I certainly think that that is a possible scenario. I also believe that we in this country in particular are very good at extremes. We're not very good at being in the middle. So when people go on a diet or they want to eat healthier, they now classify their foods into good foods and bad foods. And if they're eating good foods, they don't eat any bad foods, quote unquote. You know, certainly we know that a bowl of ice cream or a candy bar or cookies here and there are not problematic. But if we take them completely out of our diet, I really find that human nature draws you right into those foods, and so you end up binging on them. So whether it's a physiologic hunger because you have been restricting your calories, or it's a psychological restriction you've imposed on yourself, and now you're going to do an all or nothing type eating like this young man, you know, sounds like he's doing.
Okay.
I think it's possibly two-part. One other thing I wanted to mention, Chris, sometimes when I am working with my clients, I will say to them, if it appears that they're eating for some other reason besides hunger, from a nutritionist standpoint, I'll say, what are you really hungry for? And sometimes that is a light bulb, and you know, so they recognize, well, you know, I'm not really hungry for food. What else? And you were talking about the nurturing and the comforting, and so just, you know, a buzz phrase there to throw out.
Okay.
And I would just add to what Jody was just saying, that which is taboo to us, we most hunger for. So if we do tend to locate badness in certain foods, we are also going to very much at times desire those very things, whether they're good for us or not. It's part of human nature.
So then would you say to avoid binging on a favorite food, let's just say chocolate, then you should learn how to manage eating it as opposed to not having it in the house and really restricting yourself?
I would certainly say that that would be one way to handle it. You know, another story, I had a client who worked with his father who drove a truck for Hershey, for the chocolate company. And so he was bombarded with Hershey bars all the time. And as he got older, you know, couldn't look at them at all, was not a candy person at all. You know, so that's one extreme. I think if we bring food to the table, and that's just, you know, sort of a saying, and let it be always available, then it's not as much of a, it's not something that we yearn for so much. If you can have a cookie every day, you know, why do you have to eat the whole bag tonight? If you give yourself permission to eat.
Well, what I'd like the listeners to really get a clear sense of is, what is an example of a binge? So for example, I mean, I want to say that if the one cookie a day, that's very controlled. Most people I know will say, there's no way I can only eat one, or if chocolate's in the house, it's going to be gone, and I'm the one that's going to demolish it. So is a binge eating it all till it's gone, or is a true binge eating more than one type of food and just going on and on and on like a vacuum cleaner? Can you give an example of what a binge really looks like so we have that out on the table?
Yeah, I had a client, and her definition of a binge was she would literally drive to every establishment that served ice cream. She would go to Meyer's Dairy, she would go to Ben & Jerry's, she would go to the Creamery, she would go to Wegmans, she would go to Giant, and she would get ice cream, a serving of ice cream, maybe a double, maybe a triple. And she would go from place to place and consume the ice cream, and then she would make herself vomit.
Wow.
Now there are other binges that look like a lot of different types of foods. You know, a 10-piece chicken nugget, an apple pie, a box of cookies, and a half-gallon of ice cream.
Okay. Well, we have some callers. Tina from State College, can we take your call?
Hi there.
How are you?
Good, thank you.
How can we help?
I was just listening. I was hospitalized. I'm going to be 40, but I was hospitalized when I was young for anorexia and bulimia. And throughout still to this day, I struggle with my weight And I also do this, and I've done this since I was 14. I get up through the night and I eat, and there was a period where I would get up and I don't remember it, but now I remember, and it's like a cycle. What I do is I'll get up about every 2 hours, and it's very frustrating. I'll get up and eat, and then through the day, like, I try and control it because I feel so horrible for eating through the night. And I do see someone, and I'm trying this, like, to eat protein because I crave, and like you were just saying, sugar. Like, if I make something sweet, it's gone. I'm up through it, and like I have binge foods like peanut butter and different things, and it's frustrating. I know I struggle with like self-esteem, how I look, and I know people say to me I'm not fat. I'm about 5'9.5", and I weigh about 140 pounds. But it's just, and I don't know what to do. It drives me crazy. This getting up, eating every night after night after night. It's like I can't control it. I don't know what to do. So I don't know if you have any feedback on that. You know, that the person I see now is seeing if it's still the eating disorder, or maybe I have a sleep disorder. But it's just awful. So I was just wondering if you would have any suggestions or anything.
Okay. I'm glad you called. Let's see what Dr. Elfant says.
Okay. I hesitate to say very much about what I think is going on with Tina, but rather to talk about what I said some minutes ago at the beginning of the program. I don't treat eating disorders. I treat unique individuals with their own special, singular life story who are struggling with issues of food and eating. So the kinds of questions I would ask about Tina or to Tina would be, what are her unique, singular triggers to her difficulties? Because it's clear she's been struggling for a very long time around what she was describing, but odds are there are likely developmental roots, unique developmental roots to her life story that are part of what are still driving her behavior, in addition to whatever current stresses she may have.
Okay. You're talking to Tina.
Yes.
Yeah, okay. So, Tina, it sounds like you're getting some good advice now, and I just wanted to ask you, are you getting some physical activity?
Yeah, I'm very active. My work is active.
Oh, great.
And then I exercise because I'm like I just have this thing. I think it goes along with self-esteem. Like I just don't want to be fat, and I'm not. Like, I know that I'm not, but it's like it's just awful.
Mm-hmm.
But yeah, I am. I exercise at home, and then the work I do is rather active.
Okay. Well, I congratulate you for being in counseling situation and getting your physical activity. So, keep doing what you're doing. It sounds like it's a good start. So thanks.
And something else I wanted to mention. Somebody said about hereditary. Because my father woke in through the night like this, and I have a 21-year-old daughter, and she does the same thing, and that sort of sparked like when somebody there said that, because she does the same thing that I do. She gets up and eats through the night, the same thing. So thank you for mentioning that. That's something I'll look into.
Thanks so much for calling. Let's talk to Dave from State College. Hi, Dave.
Good evening. Thanks for taking my call. My question is related to my 20-year-old daughter who has been diagnosed with an eating disorder, and just today, I hope, started counseling at UPMC in Pittsburgh because she was referred to that facility for her problem of not eating properly. She's 5'6", 100 pounds, and if she was any lower than that, they would have wanted her to be in an overnight facility, but she's in a voluntary program just starting today. Is there anything more local in the area? She lives in Altoona, than having to go clear to Pittsburgh for her 4 to 6 week program.
Do either of you know of a local program?
Locally in the State College area, unfortunately, there's not a comprehensive program like that. You'd probably have to go, well, it would be a little less far to go to Hershey, and they have a program, but right in the Center County State College area, unfortunately, it's a service that's lacking, which is why Allan and I try to work together when we can, along with medical professionals.
Okay.
I would like to also add that as important as these 4 to 6 week programs are, and they are for many people, really it's the follow-up that is so essential, whether one goes into residential care or the kind of care you're talking about in terms of your daughter. Eating disorders and all the suffering around them take quite a while and quite a lot of courage on the part of the person who is in distress, as well as qualified professionals to engage after the residential or non-residential several-week program.
Okay. In case you're just tuning in, this is Your Health, and we're hoping you'll join the discussion. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're talking with Jody Whipple, a nutrition therapist, and with Allan Elfant, a clinical psychologist. We're talking about the treatment and understanding of eating disorders. Call us with your questions at 1-800-543-8242. So let's take a call from Florence in Clearfield. Hi, Florence.
Hi, are you there?
Yes, I am.
I don't know if this is a eating disorder or not. That's why I'm calling. I go like 3 or 4 days without eating. And then when I do eat, it's just like maybe a bowl of cereal or a piece of fruit or something. I just don't like food. I don't like eating food. And I just don't know what to do. I don't know if I can change this or how I can do this. I mean, I'm a heavy person, and I'm not losing weight from not eating all this food. So what can I do?
Allan, you want to start in?
I was hoping Jody would say something first while I got my thoughts together.
Well, I certainly think that it sounds like something sinister is going on. You know, again, to say whether or not it's an eating disorder is hard to do right now, but I certainly think it would be worth, Florence, at least starting with your primary care doctor and possibly looking into some counseling options.
I do counseling.
You do?
Yes.
And are you getting any information as to why this behavior might be occurring?
Well, I do suffer with bipolar and stuff like that, but I don't know if that has anything to do with the way I eat and stuff. I've always been like this since I was a kid. So it just, I mean, I'll have a cup of coffee with sugar just so I can keep my sugar level right, but other than that, I just don't like eating.
Sure. Go ahead.
Well, Florence, one of the things that's really helpful, have you seen a registered dietitian?
No.
See, that's the kind of counseling that might be a really good idea to start with, and that individual is a qualified nutrition professional who could work with you on keeping track of the foods that you do eat. And, you know, even the coffee with the sugar, we would begin there, that you had a cup of coffee, you had sugar, then how does the rest of your day look in terms of calories coming in? Because after all, calories are energy, and you deserve, as a human being, you deserve to have energy. So I think that registered dietitian could be a really useful person to help you understand what foods might be really beneficial, and you could take baby steps to get back into a healthy, balanced eating plan, and it may actually help bring your sense for eating, your taste buds back to wanting good, nutritious foods. It's a start, and it may be a place that you might want to investigate.
Okay, thank you.
I did want to say one more thing.
Sure.
In terms of Florence. She talked about having bipolar disorder. There is a very high correlation between eating disorders and mood disorders. Depression is very much part of anorexia nervosa and bulimia nervosa, and for that matter, binge eating without purging. For this reason, sometimes it's advised that individuals experiencing these disorders it's recommended they be on antidepressants in addition to getting intensive psychotherapy.
Okay.
As well as nutritional advice, as you were saying to Florence.
Right. I think the combination of all of those treatment modalities, and we really haven't gotten into the treatment idea yet. So, you know, Allan, your concept of, or your statement that there is a strong correlation between depression and eating disorders. Is that always the case?
one ought never to say always about anything, really. And that's where I go back to the individual's unique life story. But these are generalizations that we're making here, and that will hold true most of the time. They may not hold true in any particular unique individual's life story. But if you think about the compelling need to binge and then purge, or anorexia nervosa, which is really self-starvation, or binge eating without purging, it makes sense that they're going to be depressive correlates, meaning associated feelings of depression. But odds are, in some ways, the eating disorder has been an attempt to resolve deep depressive feelings about maybe lots of things: the person's family origins, what they're struggling with in terms of relationships currently, their own career paths and their satisfactions or dissatisfactions, going from puberty to adolescence to young adulthood. And we all know how hard that is these days in terms of all the pressure on youngsters.
Yeah. What if you suspect that someone close to you, a child, a friend, a relative, has something going on with their eating behavior? Maybe someone is suspicious of anorexia, or maybe even of bulimia. What should they do, if anything?
Well, I think it's very important. I'm assuming that the person who has this suspicion has some relationship with the individual. It could be a parent, a sibling, a friend, a teacher. It is so important to be able to find a safe, peaceful space to be able to have a dialogue around something that is very hard to talk about. It's hard for the person who may be experiencing and having a bona fide eating disorder, and it's hard for the other person. These are secrecy disorders. They are concealment disorders, and it usually means that people around the person suffering from this have looked the other way, have been too embarrassed themselves to be able to bring it up, don't know how to talk about it, much like sexual matters are not known how to talk about directly. But even if one is clumsy, to get it out there over time, not one discussion or two, because likely the first one or two discussions may be unsuccessful. But of course, to communicate one's genuine caring and regard for the person and genuine worry.
Okay. If you're just joining us, this is Your Health, and we're inviting your calls. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're talking with Jody Whipple, a nutrition therapist, and with Allan Elfant, a clinical psychologist. We're talking about the treatment of eating disorders. Call us with your questions at 1-800-543-8242. Well, Allan, I wanted to follow up on that last statement. You know, talking about or confronting gently someone that you might know that may have an eating disorder. What if the individual that you confront denies it? Then what?
Well, more than likely that will be the response.
Okay.
Because these are not only concealment disorders, they are shameful disorders. So think about any of us. When we're embarrassed or humiliated or ashamed, we want to hide, we want to cover up. I think it's very important to go gently into the conversation, to be persistent, to of course indicate what evidence do you have, what are you noticing, what are your concerns, and to be able to speak about this in a non-judgmental way. Now this can be very hard for family or friends that may have been sitting on their own tension and not saying anything, as the person they're concerned about may look like they're wasting away or getting very unhealthy. So sometimes well-intentioned conversations turn out to be lectures, which is certainly one way to close the person down. It's important to keep it as an open dialogue and to say what it is that's making you concerned.
Okay. Well, let me be the devil's advocate, but in a positive way. Instead of the person denying it, what if the person admits it and says, you know, yes, this is happening to me? What's the next step?
Well, it's a wonderful beginning. And I would hope then that that courage to admit is appreciated. Because again, it's so important to realize that these are shameful acts. They have occurred because of so much that the person is struggling with. So the next step is, once the admission is there, then the need for help needs to be addressed. How to get it, where to get it, what does it mean, what will be involved. And I think we're all in agreement here about the many-pronged approach to have a psychologist or a psychotherapist dealing with the counseling or intensive therapy, to have a dietitian involved who knows the specifics of diet and nutrition, and to have an available physician and perhaps a psychiatrist. But that said, it's so important to involve professionals who know what they're doing with eating disorders. All too many professionals really are undereducated about eating disorders.
How would a person find the right therapist? Is that in the phone book? You guys know.
Well, that's actually a very good question. It's not easy to find the right therapist.
Okay.
I mean, one of the ways to find a therapist is to ask one's healthcare provider, hopefully a knowledgeable one in eating disorders, about who may specialize in this. Okay. But that may be difficult. It may be hard to admit to one's own physician about what's going on, or believe that that will be judged and evaluated and lectured about rather than understood. To find the right therapist is very, very difficult. One way is to get recommendations from people you trust. For instance, many of the people I see now, I've been in this community many years, get my name through word of mouth, from people who have worked with me or people related to people who have worked with me, and they have some idea of what I stand for and what my training is. There are also ways to find out, the internet is a very good resource sometimes, what people's training is and what their background is. And of course people need to have the basics. They need to be licensed professionals in their given disciplines. But that's never enough. If you select somebody and you make an appointment, remember it's a consultation. You're not wedded to that person. You need to find out what are their thoughts about what you're describing, what are they going to suggest. Do not be bashful to ask them what is their experience with eating disorders. How do they work with such people? How do they feel about working with such people? These are important questions to ask, and how that's going to be answered will tell you a lot whether you can form a relationship with that person.
Okay. Jody, do you feel the same way that dietitians like yourself need special training in eating disorders?
Absolutely. You don't come out of your didactic education and your internship knowing how to treat eating disorders. It certainly involves more continuing education, some supervision if possible. Self-education is very important. You can go to the American Dietetic Association website, which is www.eatright.org, and you can look up dietitians in your area, and oftentimes they will list their specialty area. But like Allan said, don't ever feel like you're wedded to the person once you start. I almost always require that somebody who comes to me for an eating disorder also find a therapist. And when that person asks me, well, how do I find a therapist? I remind them that you're interviewing them for the job. You know, that you're worth the effort that it's going to take to find somebody that you click with and that you feel comfortable with and that you feel understands you. And I feel that that's true for dietitians and psychologists or psychiatrists as well.
Okay. Well, the two of you do a lot of work together as a clinical psychologist and as an expert nutritionist with training in eating disorders. If someone comes to you, Jody, with eating disorder issues, is it your inclination to send them first to Allan, or will you counsel them alone, and then if you don't make strides, send them to Allan? How do you work together?
Yeah, that's a good question. Generally, I will see a client 1 or 2 times if they come to me with a diagnosed eating disorder. And if they do not then go to see a psychologist, I may have to terminate treatment, at least for the short term, because an eating disorder is a psychological disorder. So, you know, it's not about the food, and more intervention definitely needs to happen. And then when I make a referral to Allan and we have both seen the client, the two of us are pretty good about touching base with each other. We'll meet for lunch or we'll talk on the phone about our mutual clients, and I get a lot of really valuable information from him. You know, why are we possibly not making progress in this area? Can you give me any information? And we of course have the client sign consent forms so that we can talk back and forth to each other.
Okay, so did the two of you develop a treatment plan for the client that you're mutually working with so that you can see if you're making the progress towards the treatment plan?
Well, I would put it this way. If I'm working with someone with an eating disorder, it's going to take time for me to be of use and to be of help. It would be very, very unusual. I wouldn't say never, but it would be very unusual for such a person to be with me for a time and not listen to my request that they consult a dietitian in a regular way. I do not want to get into, as a psychotherapist and as a psychologist, the specifics of weight, diet, nutrition. I really leave that to Jody, to people who are expert in that. I know some things about that, but that's not my area of expertise. My area of expertise is to help people identify what is ailing them, sort out what has led up to it, work through what that is, and see about what alternatives they may have to address their emotional issues.
Okay. I want to we've spent a lot of time talking about the eating disorder and maybe even some treatment modalities. I want to just shift gear, the same subject, but away from the whole female concept of binging or anorexia. And I understand that there's a new book out called The Adonis Complex, and that really focuses more on some of the new trends that we're seeing in male eating disorders. Is that right, Jody?
It is. It's actually not a brand new book. It's probably been out for about 5 years or so, but it does address the 10% of eating disorders out there that occur in men. And you know, we were talking about all the different types of eating or reasons for eating disorders, and certainly the media plays a very large role in influencing how young men and men in general view themselves and feel like they should look and feel like they should age. And so the Adonis Complex talks about why men and young boys get eating disorders, what are some of the reasons, and quite honestly, there's not a lot of information out there. Most of the studies are done on females because it's a predominantly female disorder, but we were talking about different sports that make people vulnerable. Wrestling is a sport that can make young men vulnerable to eating disorders because they need to be wrestling at a certain weight class and they need to be very strong. And of course, as a sports nutritionist, you know this, sometimes they engage in practices that aren't healthy to be strong yet meet that weight criteria, so they might get into vomiting or diuretic use or water restriction, things like that.
And although in the case of wrestlers that may seem transient, like they do it just to make weight for this competition, I believe there is some evidence that in certain individuals it carries on outside of the wrestling practice as well.
Absolutely. Just like anorexia in females, it oftentimes begins just with a diet to lose a few pounds. And then because of the other contributing factors, be it genetic or familial or biological or what have you, it cascades into something much more serious.
So with that said about how an eating disorder could start with a mere diet. Someone says, I think I should lose a few pounds, maybe even a doctor suggests it. Is that actually possible that it could stimulate long-term starvation, self-induced starvation like anorexia? Should parents be very concerned about talking to children about losing weight? I mean, we have this obesity epidemic on our hands. We're implementing new systems in schools to identify who's overweight. Could this actually have a counterproductive effect if we talk to adolescents, children about losing weight?
The word diet is chilling in our culture. It really is. Almost everybody's on a diet, particularly if they're female, but not only. Men just aren't as candid about talking about it for many reasons. I do want to go back to what you asked, Jody, about males. My experience with, because it seems such an under-talked about area, boys, young men, men with eating disorders. While the statistics say it's much less, these are still individuals suffering. And my experience with males with eating disorders is limited for understandable considerations. There is some evidence from my own clinical practice over the years, as well as clinical research, that males who struggle with eating disorders are underneath it struggling with their own sexual identities. This is not dissimilar to females struggling with their sexual identities. It's very important to realize that men in no way are exempt from their own anxieties around, are they men? Are they men enough? Are they male enough? I wanted to add that as you were talking about the book on the Adonis complex.
Yeah, that's very, very interesting. And I'm glad you brought that up. So I really want you to respond to, do you think we need to be extremely sensitive today with all of this obesity epidemic looming in the newspapers, in magazines, and a now big focus on the obesity and overweight epidemic among our children in the United States? Never before has it been as bad as it is today. Do we need to be sensitive about how we talk to children about their weight?
We definitely need to be sensitive. In fact, if we look at the studies done by Leanne Birch here in the Human Development School at Penn State, she has shown that young girls are much more likely to suffer from eating disorders if their mothers are dieters, and that modeling behavior by mothers is one of the biggest influences in children's eating. So if a mom is on a diet, or if a mom looks in the mirror and says, oh, you know, I need to have a flat stomach, or if a mom is always complaining about how heavy she is, then that message is going to get passed down to the daughter. And, you know, I think probably the son as well. I do think we have to be very sensitive. We do a lot of talking about types of foods that we eat and the amounts of foods that we eat, when I think one of the bigger issues is how we eat. We don't eat at the dinner table anymore. We don't, you know, we don't take the time to celebrate. We don't take the time to just be together, as Allan was saying at the beginning. We eat in a social context, and we base our eating on external factors rather than listening to when we're hungry and when we're full. When we're born and babies are fed, we know that they're hungry because they cry, and we know that they're full because they fall asleep or they push their food away, and somehow adults or other, you know, well-meaning individuals interfere, and we lose that ability to recognize simple hunger and fullness. And so I think we need to be very sensitive with our children.
Paying attention to those body cues, your own individual body cues.
Right.
Well, Allan, if you were going to see a child, someone, let's say, under 12, with an eating disorder, is it your best practice philosophy that the parents should be involved also in the counseling environment?
From my perspective, yes. In fact, I think I would make a generalization here, and of course there would be exceptions. Any minor who lives in the household, to treat them alone is questionable in the sense that they're part of a family context. And usually, and this really isn't to lay blame, it's to try to understand the parents and or siblings may be contributing to the difficulty in ways they're not even aware of. And in fact, their best intention may be everything to make sure their child is healthy. But our own attitudes, as Jody was saying, there's so much evidence that mothers of young girls and young women with eating disorders struggle themselves with their own notions of their own bodies. And there is some recent research about the connection between fathers' attitudes toward eating and body shape and their daughter struggles with eating disorders. And sometimes the fathers themselves struggle with their own body images.
Well, with older children, the 20-year-old that the gentleman called in about, should parents be involved when you have an older child, 20 to 25?
This is a little more complicated. Since adolescence is longer and longer, I mean, it may go into the 40s now if we're not careful. I mean, when do we actually grow up in our culture is an important topic. My own predilection is once somebody is going to college, to as much as possible treat that person in order to encourage their autonomy. That does not mean the family should be excluded. Okay. They may be included in an occasional kind of meeting. But that's my own bias in terms of promoting autonomy, because in many ways, people who suffer from eating disorders, who are young people, are really not able to separate from their families, and their eating disorder is actually keeping them stuck in their families.
Okay, excellent answers. Thank you so much. It's all the time we have tonight. I want to thank Jody Whipple and Allan Elfant for being here tonight and answering your questions. I also want to thank all of you for your calls and comments. I hope you'll be here with me on October 3rd when I'll be talking with Dr. Nance Williams about how hormones and calorie restriction affect bone health. For Penn State Public Media, I'm Chris Clark. Good night.
A copy of the program you've just seen can be purchased through Penn State Media Sales at mediasales.psu.edu or by calling 800-770-2111.